Good morning, friends. Today we are going to talk about the movements of hip. So in hip joint, you can understand that there will be six separate movements, which can either occur in isolation or simultaneously to create a smooth joint motion we are familiar with. मीन्स कुछ जॉइंट्स का मूवमेंट सिंगल भी करके देख सकते हैं, कुछ हमको दूसरे जॉइंट्स के साथ करके देख चलना पड़ता है, जैसे कि मूवमेंट बहुत अच्छा हो पाए हमारे लोअर लिम्ब का. एंड वी कैन रिकॉल दैट लोअर लिम्ब इज स्पेशली फॉर वेट बेयरिंग एंड मूवमेंट. So one by one we can see here it is a flexion which is going to happen, extension, abduction, adduction, internal rotation and external rotation. So one by one we are going to see. There will be a small video clip also which will be moving doing the action. Like you can see here, it's flexion. So it is an act of bending your hip to raise your leg in front of you. The angle formed between the femur and hip in the sagittal plane is becoming smaller. तो जो फ्लेक्शन का डेफिनेशन था कि एंगल कम होना चाहिए विद इन द फ्लेक्सर सर्फेसेस, इट विल बी ऑलवेज रिमेन सेम, जस्ट द सर्फेसेस आर गोइंग टू बी अंडरस्टूड. So this is the act of bending your hip to raise your leg in front of you. Just see the video like this again. So when you raise your leg like this, it means you're doing the flexion of hip. And the muscles which are involved here will be in two compartments, like primary muscles and secondary muscles. The primary muscle is iliacus, and second primary will be psoas major. The iliopsoas we can say in common. So you can understand this origin and insertion. We can already talked in previous video also. One you can see here, that is iliacus. The origin will be from iliac crest. Insertion will be on lesser trochanter. Nerve supply will be femur nerve. Action will be hip flexion. Then there are certain muscles called as secondary muscles. Means they are not directly acting on it, but they are helping to stabilize the joint when the flexion is happening. मतलब ये support कर रहे हैं जब flexion हो रहा है. तो ये कौन से हैं? Adductor magnus, adductor brevis, rectus femoris. You can see adductor magnus, adductor brevis, rectus femoris, tensor fasciae lata, and sartorius. So mostly you can see these are from the anterior compartment of thigh or from the medial compartment of thigh. They are just helping in the flexion movement of hip. Next movement was extension. So extension, let us see how it was happening. Extension. So this is an act of straightening of hip or pushing your leg straight backward. Means पीछे की तरफ leg को straight लेके जाना है. The angle between the femur and the hip in sagittal plane become larger. So this is called as hip extension. You can see the video. You are moving your leg पीछे, leg को thigh को पीछे की तरफ ले जाना एकदम straight रखते हुए, and this will be called as hip extension. Now, if you are bending your knee, it means that will be the action of knee joint then. Okay. The muscles which are involved in this joint will be again in two groups, primary muscle and secondary. The primary is one only, gluteus maximus, and secondary will be adductor magnus, semimembranosus, semitendinosus, and bicep femoris. So these are the muscles of posterior compartment, as you might be knowing. Otherwise, you can see the video which has already been uploaded for hip muscles. Next, we can see the movement, that is abduction. This is the act moving the thigh away from the midline. Same definition, away from midline will be abduction, towards the midline will be adduction, and it occurs in the coronal plane. The angle formed between the femur and hip in the coronal plane becomes larger. You can see the video. Means you're moving away from the midline. You're moving away from the midline. The muscles which are helping here, again two groups. Primary group is gluteus minimus and gluteus medius. And secondary group is sartorius, tensor fasciae lata, and gluteus maximus. So these are the muscles which are helping in hip abduction. Now coming to the adduction, means towards the midline. So this is the act of moving the thigh towards the midline coronal plane. The angle now is going to be decreased. It means first of all, the leg should be already in abduction. Then only you can bring it in the adduction part. You can see the video. See, the video is starting from already abducted part. Then it's coming towards the midline. You normally खड़े होते हैं जैसे. So this is adduction. The muscles which are involved here will be again two groups. Primary group will be adductor magnus, adductor brevis, adductor longus, and gracilis. So you may recall that these are all the middle compartment of thigh region. Secondary muscle will be quadratus femoris, and pectineus. These are small muscles. So this is about the adduction. Now coming to the internal rotation. Internal rotation means the leg is going to move to the internal side. Thigh is going to face the other thigh. You can see the video like this. So you have to rotate your whole lower limb in towards the medial side. That will be internal rotation. Again, primary muscles will be gluteus minimus, gluteus medius, and secondary will be pectineus and tensor fasciae lata. So this was about the internal hip rotation. Next, external hip rotation. It will be towards the outwards. We have to move. So you can see the video. We have to move towards outwards like this. So you can see the movement of this particular joint, which is very beautifully shown here. The muscles which are involved here are abductor externus, quadratus femoris, gemellus, internal gemellus, superior gemellus, obturator internus, and piriformis. Secondary muscles will be sartorius and gluteus maximus. So this was some movements which were happening normally in the hip joint. Now we can talk about one more extra, that is seventh hip movement, that is circumduction. Because this is a ball and socket joint, the circumduction can occur. All six movements can be in one phase also, they can be coming. So what are the some major movements in sport that require circumduction? As you can know, hurdles, track and field, athletes circumduct their trailing leg over the hurdle without a significant vertical jump. Saucer, athletes are able to perform step over moves by circumducting their hip. And martial art, that is various kicks they are going to give after rotating their leg in all six directions. So this is the circumduction of the hip joint. Next, a little bit typical thing, that is biomechanics of hip rotators. So understanding the functional balance in hip rotator is key concept in grasping hip movement during the action like walking. Again, I will recall this particular joint is weight bearing and also the helping movement. The direction of pull of each muscle is depicted as the various arrows which we are going to see. So let's see the internal rotators. So you can see this is the center of rotation, that is femoral head, and this is the acetabular part. So internal rotators will be gluteus minimus will do what? They will move towards this side, gluteus medius and tensor fasciae lata. Then they will pull towards the east side, and then there will be a internal rotation will be happening. Likewise, if you see, let me remove this external rotators. So you can see obturator internus, piriformis, quadratus femoris, obturator externus, gemellus, and gluteus maximus. So this is more powerful or need more muscles to do the external rotators. So again, I will say the direction of pull related to central rotation determines the action performed by the. So what is center of rotation? This particular part, ये जिधर move करेगा उसको move कराने के लिए we need the muscles to pull it in that particular direction. So the last part of this video will be the impact of joint motion on muscle action. The external rotators are a great example of how the angle of our joint can impact the particular role of muscle plane movement. So in hip extension, during hip extension, the external rotators are just as expected. They externally rotate the hip due to the line of action reaching behind the greater trochanter. Again, you can see the video. This is how it's happening. So gluteus maximus is helping, piriformis is helping, gemelli, obturator, and other external rotators are helping. So this is what they have to do. There is no difference. Next is hip flexion. So during hip flexion, our external rotators now pull almost directly over the top of greater trochanter. Thereby, they act to pull the leg away from midline instead of rotate. तो एक्चुअल में काम वो हिप फ्लेक्शन का कर रहा है, इसमें हेल्प करेगा कौन? जो रोटेटर्स एक्सटर्नल वही हेल्प करेंगे. But right now, what they will do? They will pull the leg away from the part. You can see here, like this. This is hip flexion. So that's all from this small video. We'll again upload very soon the movements of shoulder joint.